This is Helping Seniors Television, the show all about helping seniors improve their quality of life. If you are of senior age, know someone that is, or plan on becoming a senior, then this show is for you. It's about helping you develop your own plan of action for aging, so you or a loved one can age actively and with dignity. Helping Seniors Television, from the Helping Seniors Network of Information. On this edition of Helping Seniors Television, host Joe Steckler talks with Joseph Scozzafava from Humana WellCare. Hear the latest in Medicare and what to look for when choosing a plan. What are the benefits and what are the requirements? Those are just some of the important issues discussed on this edition of Helping Seniors Television. Now, here's your host, Joe Steckler.
Welcome to this edition of Helping Seniors. My guest today is from CarePlus Health Plans, Joseph Scozzafava. And I asked Joe how to pronounce that name, and I asked him if it was Hungarian. He too quickly told me it was Italian. So,
that's right.
But I wasn't quite sure how to pronounce that one. Joe, how about just tell our viewing audience, what is CarePlus Health Plans? What do you do, and how do you serve the community? Explain the insurance and Medicare.
Sure. So CarePlus Health Plans is a Medicare Advantage plan available in the state of Florida. We've been in Florida for the past 17 years, and our primary goal is to help people who are Medicare eligible save money on their healthcare costs. And so we do that through our Medicare Advantage plans. They're HMO plans. And so we not only help people who are Medicare eligible only, but also people who have both Medicare and Medicaid through our dual eligible special needs plans.
When you say Medicare eligible, I would be willing to bet that many of the viewers don't know what Medicare eligible means. Can you explain to our viewers, when you say Medicare eligible, what the heck do you mean by that?
Sure. So for most people, when they turn 65, shortly before they turn 65, they receive a postcard from Medicare, which includes a Medicare card. That Medicare card basically is their original Medicare card. It shows Medicare Part A, which is their hospital coverage, and Medicare Part B, which is their medical coverage. Their hospital coverage basically has been funded throughout their lives through payroll tax deductions. So they're paying for it throughout their lives. Their Medicare Part B, they will pay for once they get onto Medicare. And so again, for most people, they become Medicare eligible when they turn 65. For some people though, if they receive Social Security disability benefits for 24 consecutive months, they're also awarded Medicare. And so they get same process. They receive that Medicare card in the mail, same funding process in terms of the Medicare Part B costs through their Social Security deductions and their Medicare Part A, mostly through payroll tax deductions throughout their life.
In Florida and in other parts of the United States, we have one huge industry that goes out and cuts grass.
Right.
I would be willing to bet my bottom dollar that many of those people don't have payroll deductions. So those people would not be eligible for Medicare, would they?
I would imagine they would not be eligible, correct?
So when we talk about Medicare eligible, there's probably a lot of qualifications behind that.
There are.
Yeah. And I think this is something that when people are young, if not only are Medicare eligible, but these people, they can get in some of these grassroots industries, cut grass or provide home type services that they're self-employed. If they don't pay into the tax system, they're not going to be Social Security, they're not going to be Medicare qualified. So we're talking about a huge number of potential people.
Well, so they may still be eligible in terms of the qualifications, being a citizen or other requirements that Medicare provides. And certainly they can go onto Medicare's website and review those qualifications. But what they might have to do when they get older is pay for a larger share of their Medicare costs. So whereas somebody who has payroll tax deductions throughout their life and it funds their Medicare Part A, those individuals who haven't had that may be responsible for those costs at the time that they become Medicare eligible.
Okay, so it makes it all more important that people know about organizations like CarePlus Health Plans.
Sure. What we do for people really is educate them on what's available. And so a lot of times, and we have an office locally here in Melbourne, people come in and they just have questions. And so it may be, what do I need or how do I get onto one of your plans? And so we basically educate them on the things that they need to do or the processes that they need to take in order to be eligible for a plan.
But does CarePlus Health Plans deal only with Medicare?
We do. So CarePlus is basically specifically a Medicare Advantage or Medicare Advantage health plan. So it's for people who have Medicare only or people who have both Medicare and Medicaid.
Okay, so what happens if a person comes in and for some reason, what if they're not Medicare eligible? And then how do you help them get insurance?
Well, we explain to them that, our office locally is Medicare specific. However, we direct them to other resources who do offer insurance for people that are not Medicare eligible.
And that one of the top ones you use is probably Shine.
Absolutely. And so Shine is a great resource for people in the community, helps them with information about what their insurance options are and helps them with other resources in the community.
When we talk about Shine, folks, that's as an acronym, it stands for Serving the Health Insurance Needs of Florida's Elders. And it's important because it shows how Shine is a nonprofit. It doesn't sell insurance,
right?
But it recommends people to go to you. It would recommend people to go to other types of private insurance that for people that may not be covered by Medicare.
Absolutely.
But we're going to talk about Medicare today.
Okay.
You mentioned Medicare Part A. Let's go into Medicare A, B, C, and D. And
sure.
Will you talk about the donut hole too?
Sure, I can speak about the donut hole a little bit.
Okay. I'll put you in A. Now you get from A to A, B, C, D, and then a donut hole.
Okay, fair enough. So Part A and Part B make up original Medicare. And Part A refers to your hospital coverage. Part B refers to your medical coverage, for example, when you go to the doctor. Together, Part A and Part B cover most of your healthcare costs, but not everything, including prescription drug coverage. It does not cover. So in order to provide other options or more thorough coverage, they introduced Part C and Part D. So Part C is Medicare Advantage Plans, and Medicare Advantage Plans are plans like CarePlus. And Part D is your prescription drug coverage. Thinking of the donut hole, that refers to Part D coverage. And so the donut hole basically with prescription drug coverage, and prescription drug coverage is a complex process or complex type of coverage. Basically, there are 4 levels of coverage, the first level being a deductible. Once you meet that deductible, a person reaches the second level called the initial coverage limit. They remain in the initial coverage limit till they spend a certain amount of money, they reach a certain threshold, and then they reach that coverage gap or donut hole. And everybody hears about the donut hole and gets really nervous.
I know.
And for good reason, because what happens in the donut hole is people become responsible for all of the cost of their drugs. However, because of healthcare reform, they get discounts from the manufacturers of those drugs. So they're not truly paying the full amount. They're paying a percentage of those costs. Now that percentage has been shrinking year over year. And so, at this point in 2018 and coming up in 2019, it'll be at that cost share responsibility will be at its lowest.
It'll be what?
It will be at its lowest. So the amount of money that a person who is in the donut hole will be responsible to pay themselves will be lower than it had been in 2017, 2016,
So
2015.
the cost will go down?
Correct. Well, the percentage that they're responsible for will go down. The cost of the drugs, that depends on the drug that they're taking.
That's, as being a representative of healthcare, of CarePlus Health Plans, and dealing with prescription drugs and everything, and I'm sure the question comes up, but do you often encounter people that simply cannot afford their drugs?
We do. And so there are a number of resources for those people. The kind of, I guess, the most popular or the most obvious would be LIS, which is low income subsidy. It's extra help with prescription drug costs through Medicare, through the federal government. And so if someone's income and assets are below a certain threshold, they can be awarded that extra help. And so their prescription drug costs go down dramatically. Now, for some people, they're just beyond those income and asset thresholds. And so they need to look for other resources. And so there are other resources out there. And what we're able to do at CarePlus is we can educate people not only about LIS and how to get LIS, but also what those other resources are to hopefully help them get on one of those resources.
Okay. What is the advantage of going with a healthcare advantage plan? What are maybe some of the good sides and bad sides?
So in terms of advantages, Medicare Advantage plans are designed to provide all of the coverage that original Medicare provides, plus additional coverage like prescription drug coverage. Those types of plans can include coverage beyond just prescription drug plans as well, things like routine dental and vision care. Some plans offer over-the-counter benefits for people. They can offer transportation to and from healthcare providers. So what happens is the plans provide more coverage than someone would get if they were just on original Medicare, and they typically do it at lower costs than original Medicare. On the downside, or in terms of negatives, I guess the most obvious would be there are networks. And so on Medicare Advantage plans, for the most part, you have to see the doctors and hospitals that are in the network. And so...
You're talking about the network?
Correct.
Okay.
Correct. And so that would be, if I had to identify something that could potentially be a negative, or I guess a better description would be it's a restriction. And so you just have to see the providers that are in the network. And for most people who go from working and having group coverage through their employer and graduating into Medicare, they're used to networks anyway because their group coverage already has networks.
You brought up something I'm going to ask you a question on. And talking about coverage, are you finding that fewer and fewer employers are providing coverage?
Well, I don't, in all fairness, I don't know the answer to that question. I hear things in the news and things are publicized saying that, but I don't know that for absolute certainty.
Okay. That's because I mean, some of these things you're not going to know the answer to.
Sure.
But the question is, I can always ask.
Absolutely.
I can always ask it. Do you still get people coming in to you and say, well, how do I get the Medicaid to cover my my cost or something? You still find people that don't know the difference between Medicare and Medicaid.
We certainly do. And what we do is we sit down with them and we educate them. We explain what the differences are. We explain, what it takes to qualify for Medicare. And then we speak about what it takes to qualify for Medicaid. And what we typically do beyond that is ask if, based on the information we're providing, do they believe they qualify for Medicaid? And if they do, we help them to qualify for Medicaid. And so we have services through CarePlus that can help people qualify for Medicaid. And so that's another great service that we offer. It doesn't cost anything to the consumer.
Oh, wait, you're saying that CarePlus helps people qualify for Medicaid?
Correct. So we help them apply for Medicaid.
Okay. We didn't have this listed as anything we would talk about, but Um, is there any kind of advice that you could give to a viewer when they're talking, when we're thinking about Medicaid? Is there something that you could tell a person what some of the good things or bad things they could do to prepare for Medicaid?
Well,
Just
from
from your own experience.
Sure.
From healthcare.
Right.
CarePlus.
So for us, we primarily work with people who have both Medicare and Medicaid. And so for those people, again, we kind of go through that process that we spoke about. For people who have Medicaid only or wish to qualify for Medicaid only, there's not really anything you can do to prepare. It's really just a matter of applying and describing your circumstances.
Okay. You either qualify for it or you don't.
Correct.
And you can, I don't want to use the word game the system, but there's always ways to work things. If you have a need, if you get to the right, I guess what I'm saying is, if somebody comes to you and you can't help them, you can refer them to somebody like Shine.
Sure.
Which is a nonprofit organization, doesn't sell a product.
Mm-hmm.
All it does is takes advantage of the experience they have within their network to recommend people. Because I'm sure they get people coming in and they refer them to you.
Yep.
And that's the advantage of having organizations that are willing to work together.
Absolutely.
Oh, and what are the eligibility requirements for Medicare, or are there any?
There are eligibility requirements. So to enroll in a Medicare Advantage plan, basically you must be entitled to Medicare Part A, enrolled in Medicare Part B. You also must live in the plan service area. So for most plans, service areas are specific to a county or specific to a state, depending on the plan. And again, back to the end-stage renal disease. That's the only health-related question. So someone cannot have end-stage renal disease unless special circumstances exist.
Make sure that people are going to understand that. That's something I was going to ask about. Hit that word again.
End-stage renal disease. So that's kidney failure, and so that's a specific diagnosis. So you can have kidney disease, but end-stage renal disease is a specific diagnosis, and it's a specific question that's on an application.
What happens to people though that have that disease, Joe?
So if someone has that disease and they're not already on a Medicare Advantage plan, so they're just on original Medicare or they're going to be on original Medicare will provide their care. If they're already on a Medicare Advantage plan and they get end-stage renal disease, then the Medicare Advantage plan will provide the care.
It will take care of it.
It will. It will not remove them from the plan. They will remain on.
Let's say all this that we hear, if you have certain, I guess what you're saying to me is that if a person has a problem, the way we've sort of worked the last several years, that there's a way to solve that problem.
There's always some type of solution. It's just a matter of listening and figuring out what the best options are for someone.
So why is it that we read so much in the newspapers and we hear so much on TV about if you don't have insurance, you're not going to qualify, or is that where these $15,000, $20,000 policies come in play?
Well, I think you hear about these things because industries pop up, because of misinformation, because of a lack of understanding. The reality is, I don't know if all of that is true. I really ultimately think it's a matter of misinformation and people needing to seek out additional information and additional guidance. And places like, our office is certainly a good place to start, or your local Shine office is also a great place to start.
You're the manager for Brevard County and Indian River County.
Correct.
That's a tremendous area to cover. You have CarePlus agents, plus you have, what other networks do you have that sort of work with you and to solve problems?
Sure. So we have agents that work directly for us, our career team, but we also have brokers throughout both counties who work with us. And so what we do is we educate them on the products and services and resources we have available. We do this regularly to make sure that they're up to date on all of the resources that are out there. And so not only do our career agents go out and meet with people, but also all of these independent agents that are contracted with us, they also have the ability to go out and meet with people. And because it's such a large territory, those independent agents play a really important role in that process.
I'm thinking of what are some of the problem areas that you've encountered as you try to work with potential clients that come to you? Can you cite a couple of things that viewers can maybe they can help them understand how the service is that you provide?
Sure. I think the biggest or most accurate way to describe it is education. And so many people come in and see us and they don't know anything about what their options are with regard to Medicare or with regard to Medicare and Medicaid. Some people believe that they know what's available, and then they sit down with us and they realize they didn't know everything that was available. And so they realize that maybe what they had up to this point may not be in their best interest. And so they realize, I need to take a closer look at things before I make an absolute decision. And so, I guess the short answer is education and guidance.
Okay. I'm thinking myself of, you mentioned earlier in our talk about people traveling. If a person is Medicare eligible and they know that they're going to travel a lot, I think they would be best to stick with traditional Medicare.
Well, it depends. And so one, it depends on where they're looking to go. If they're traveling outside of the US, or if they're traveling domestically. There are different types of Medicare Advantage plans, and some of those plans allow you to travel outside of your service area.
Oh, I've never heard that. Okay. Let's say, when you're saying, my understanding of an HMO is that with the Medicare Advantage plan is that they have a network of doctors, and if you go outside that network of doctors, you go outside the state, and there's an emergency, then you're covered anywhere in the United States.
That is 100% correct.
That's correct. Now, how about, are you saying to me that there are Medicare Advantage plans that will allow you to travel outside that network and still be treated for a treatment, say, if I just didn't feel good or it's not an emergency situation?
Correct. And so those plans are PPO plans, but they're also Medicare Advantage plans. So Medicare Advantage plans is kind of the umbrella, and HMOs and PPOs and private fee-for-service plans fall under that umbrella. So in the case of PPO plans, you still have a network of providers, you still have a service area, but you have the ability to go outside of that service area as long as the PPO plan that you're working with or that you're on has network providers in that other area. So if someone lives in Brevard County but spends time in Michigan or New York or Texas or California, and they check to see if their PPO plan has providers in the area where they go visit and they wish to receive scheduled care in that location at one of those in-network doctors, they'll be treated the same as they are here.
Well, but what if they don't? What you're saying is they have to have a network of doctors that's sort of part of that original Medicare Advantage plan network. What if they don't have any doctor? Let's make it specific. Let's say I go to an HMO that's in one county,
right?
And I'm in California,
right?
And they don't have any connections out there in California, and I have an emergency. This HMO still covers the emergency out there in California.
Correct.
But if I have a strep throat or if I have, strep throat.
Well, so in an HMO situation, it's urgent care or emergency care. So in the case of strep throat, you go to the nearest urgent care center, you're covered just as if you were here in Brevard County. However, if you wish to receive scheduled care on that HMO in California, you could not do that.
But it would cover going to an urgent care?
Correct.
then why don't people talk about this more? You know,
Well,
I look, I've been doing this since 2007,
right.
and I have never heard anybody talk about the fact that there's a way to get that kind of coverage if you're in a Medicare Advantage plan. You're the first person to talk about that.
Wow. Well,
I'm serious.
I'm glad to hear that. You know, again, it kind of goes back to the earlier point, education. You know, not everyone knows everything that's available. But just kind of to circle back with regard to the PPO and to differentiate, you know, with the PPO, as I mentioned, you can receive scheduled care outside of the service area if the provider is in the network, but on an HMO, you cannot.
Okay.
But if it's urgent care or emergency care, you can on the HMO.
Because you've answered some questions there, I'm gonna do something I don't normally do. I just want you viewers to know that CarePlus was just rated as one of the best Medicare Advantage plans for 2018 in Florida by U.S. News and World Report. It's a Florida-based company. It's been around for 17 years. So I would suspect, Joe, that one of the reasons that CarePlus has been around and does it is because you have brought out things today that are not normally talked about.
Well, based on what you're saying, it sounds like I have. So that and we absolutely do that on in every meeting that we have. We explain to people how they can gain access to the coverage that they have.
That's the advantage of having. Any other 10-second advice?
Sure. I would say that meeting with someone local who knows the area, knows the doctors that are available and the services that are available, that's the best way to go.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.